All right, thank you everybody for joining us today. Today we have Sarah Hoffman, the Alberta New Democrat Shadow Minister for Hospitals and Surgical Health Facilities. Sarah will begin with a short statement. We'll then take questions from the room as well as online. If you'd like to ask a question, if you're part of our Zoom press conference, please raise your hand and we'll come to you when available. All right, over to you, Sarah.
I know that many healthcare workers, family members, patients tuned in to today's update hoping for some big new solution. Sadly, what they got was one health minister making themselves available after almost a month without having any health ministers giving any updates publicly or taking media questions through an availability like this. Repackaging a lot of things that have already been announced or things that were already being worked on behind the scenes with 4 CEOs. What we really deserve is an acknowledgement that there is a crisis. Doctors have been raising alarms for weeks. Patients and their allies have been saying that things are not okay in hospitals right now, and the government didn't acknowledge that. They try to give everyone assurance that we're through the worst part of the flu season, and I certainly hope that we are, but this isn't just a flu season problem. We've had issues with Edmonton being on diversion for almost a year. Calgary hospitals are over capacity, and many rural hospitals are closed. I think Grimshaw and Hinton were yesterday. This is not okay. We need a government that steps up, takes responsibility, shows leadership. And the other thing that doctors have been telling us that they want, and people who work in the various pillars, often under the same roof, they want to know who's in charge. They want to command and control. They want to make sure that when their hospital is in crisis, there's one person they can go to get direction and to get support so that things can move forward. And instead, right now, we're seeing a lot of stalling, delaying, and promises that years from now, there will be more acute care hospital beds. Of course, we need more acute care hospital beds. They're not even in the budget right now, the ones that they keep re-announcing. We should have built the South Edmonton Hospital years ago so that it was on capacity today to help us in this crisis, but happy to take your questions.
All right, thank you, Sarah. We'll begin with questions in the room. If you could please introduce yourself and your outlet. One question, one follow-up.
Hi, Sarah. It's Lisa Johnson with the Canadian Press. Today, Minister Jones was asked who is directly accountable for making these kinds of emergency decisions in terms of shifting patients, patient flow and patient load. And he said, basically, there is no one person in charge. I mean, as a former health minister, what kind of lines of accountability do you want to see laid out here?
Yeah, that's ridiculous. The buck stops with the Premier and the Minister, and I can tell you that when I was Minister and we were facing what I saw as crisis moments, I called daily meetings. I was checking in with my CEO. We had one CEO, but I would hold that CEO accountable. I'd hold my Deputy Minister accountable, and I'd hold myself accountable. And we were the decision-making body that could instill confidence in the system, in those who were working in it, and give them the tools that they needed to be able to address the crisis. So, yeah, I absolutely believe there is no one person in charge. And I think that that's an embarrassment. I think it's dangerous when it comes to patients and frontline healthcare workers. The Premier and the health ministers need to be stepping up. It'd be nice if we had one health minister who was willing to be the lead on this and take the responsibility and implement solutions. Instead, they've decided they're going to have 4 and they're going to have unprecedented collaboration. You know, what wouldn't need collaboration is if any single person took responsibility and showed leadership. And that's what we're calling on Albertans to do. And that's what, you know, we have about 300 doctors. I think it's maybe more than 300 doctors that have signed on to the letter calling for more solutions, more accountability, the AMA letter. That's what everyone is crying for, because the frontline healthcare workers are doing the best, but they're telling me that it's just a matter of days before somebody else dies in the emergency department, and they don't want that on their conscience. They don't want that for their patients or their family members. They want solutions, and they want a government that takes responsibility.
And shifting gears, do you support the government calling a fatality inquiry into the recent death in an emergency room?
Absolutely. It's been 3 weeks. Yep. We all need answers on what happened because we want to make sure that it never happens again.
Hi,
they should have called it sooner is my short answer on that, but, you know, better late than never.
Hi, Sean Amato with City News. You alluded to this already, but I was just checking the project pages for the Stollery, the Misericordia, and the Grey Nuns expansions or standalone hospital. There are still no timelines and no budget for any of those projects. What do you make of that? Yeah,
the Stollery, they've told them to go out and fundraise $1 billion. That's very nice. I know that there are many very generous people across Alberta who are happy to donate money to children's hospitals, and we'll do that. But the government should be stepping up and showing some leadership and actually investing in these 3 hospitals that they keep saying, don't worry, they'll come on board eventually. But they've put no money towards those projects. They should have built the South Edmonton Hospital. They should have built the Children and Adolescent Mental Health Hospital that were both in the queue. They were both moving forward. They shouldn't have canceled the Edmonton Public Lab that was being built. The Auditor General report shows that at least $125 million was wasted over the cancellation and attempted privatization of lab services. There are so many ways they could be showing Albertans that they take their health care seriously and that they're investing in it. And instead, they called one press conference with 5 people and said nobody's in charge.
All right, we're going to go next to online. I see I have one hand up so far. Mark from CTV, over to you. Oh, just give us 1 second here, Mark. We're just double checking. You want to try there, Mark? See if we can hear you. If not, we'll come right back to you. Okay, we're having a quick technical issue on our side, Mark. We will absolutely come back to you. We'll instead go to Cindy here in the room.
Hi, Sarah. Cindy Tran with the Edmonton Journal. So we learned today that large hospitals in Alberta are at 102% capacity. Doctors have that piece of advice from them and declare that state of emergency.
Making sure that I've got the best information and that I know what we can do to help address their pressures. I expect I probably would have called an emergency long ago. I also would have gone very public, encouraging people to get vaccinated for measles, the flu, for COVID, who want to get the vaccine. And I'd make it very easy for them to be able to do that. I'd share the information publicly, and we'd increase opportunities for people to do that. Instead, we're seeing measles cases again on the spread in Alberta. That's incredibly dangerous and scary. It was a year and a half ago that the then Chief Medical Officer of Health first flagged that and said this could become a crisis. Instead of waiting for things to be a crisis, press conferences with 5 people standing behind one mic, the government should be stepping up and showing leadership. So I probably would have already called a state of crisis. And is it a state of public emergency? We would have to get into the technical pieces of what that legislation says. But it is a crisis. We know that there are people who are dying in emergency departments, people waiting days to be admitted, that our emergency beds are full, and that the minister himself said no single person is in charge. That is unacceptable, and we deserve so much better.
All right, next question in the room here.
Hi, Sarah Comedino with Global News. Emergency room right now if you were suffering chest.
Know that you need help, and that's what's so heartbreaking about this story. The father, the patient, they were all there for help, and they waited a business day. And the right thing to do is to still go and ask for help. But we're hearing reports about people calling 911 and ambulances not coming or not coming for hours. When we had a lot of people off on sick leave, I called in the labor leaders and I said, what's going on? And we looked at the data and it was mostly back injuries. Well, we put in job. There are so many people who want to come up with solutions. It's going to take some money. It's also their job, just to back up a few months, that schools are open, and they totally bailed on that as well when they, left us with a 3-week-long strike, kids at home and teachers on the side.
They would consider this a crisis, the government, and they said the hospitals are under significant stress. For you, why is it important for that language to use the word crisis by the Alberta government?
Because doctors, nurses, everyone working in hospitals knows it's a crisis. And if you're screaming it from the top of your lungs and the people who are in charge won't listen to you, it is so infuriating. I've never seen morale lower than it is right now. And one of the first things you can do is acknowledge that what you're asking those workers to do isn't normal, that this isn't just a typical day at the office with slightly more strain. This is unacceptable. They deserve so much better. And if you refuse to listen to what they're saying and acknowledge the fact that they are in crisis, then they have no confidence that you're going to actually deal with it.
All right, we're going to try again online here. We'll see if Catherine at All Alberta, if you're able to ask your question. Mark, I know you're still there. Catherine, do you want to try? And we'll see if we can get the sound here.
Okay, can you hear me at all?
I can. Thank you.
Oh, hooray!
Yeah.
So I was going to ask, one of the recommendations that they're implementing is this physician triage liaison. So you're going to be seeing in the busiest emergency departments physicians who are both triaging, assessing, and perhaps even treating people in the
Yeah.
waiting room. I'm wondering, I know it was just announced, but what do you think of this solution?
Yeah, it's been implemented before in times of acute pressure. You bring in more physicians, and I think that's definitely a positive thing. It is a Band-Aid, and it is not a solution for the larger systemic issues we have, including who's actually in charge when we need to move people out of one hospital into another and those types of things. So it is a positive step, but it is such a small one. It is a very small Band-Aid when what we're dealing with is a major crisis.
And the minister was asked about, the healthcare system being starved of resources. He pushed back on that assertion. He said that, no, we've actually...
Of the public lab system, $125 million there as well. I agree that hundreds of millions of dollars have been wasted. Of the public lab system, $125 million there as well. I agree that hundreds of millions of dollars have been wasted by the UCP in the system, if that's what they want to call it. But when it comes to actual nurses, doctors, frontline healthcare workers, that's where we have a big gap, and that's what we deserve investment in. When I talk to people throughout Alberta, they're saying, I want a family doctor. Almost 1 million Albertans don't have one. And that when I show up to emerge, I want to make sure I'm going to be seen in a reasonable amount of time. They also want to make sure that they can get diagnostics, the tests that they're waiting on, get those back quickly so that their family doctors can make decisions about how to further their care. That's where the money should be going. And instead it's going into UCP pet projects focused around privatization. And it is a huge waste. We're seeing worse outcomes and lots of chaos. So I guess the minister is correct in saying that they are putting money into some areas of the system, but they're not into the right areas, and they're not into making life better for patients in Alberta.
All right. Mark, we're going to come back to you online if you want to give it a go. Hopefully the sound comes through.
Can you hear me this time?
I can, yeah.
Yeah, forgive me if this was asked previously. Surge. We haven't seen a surge like this really since November. How do you think the province is managing this situation?
Yeah, and I just checked the government's numbers on their website, and I think they said 5 cases on Tuesday, so 27 since Friday is a huge, very quick uptake. I continue to be disappointed in how the government deals with public health. They could show leadership by meeting with leaders across the province who are especially close and connected to the areas where vaccine rates are particularly low. And that's one of the ways, and I'll give Jason Kenney credit for when he was in government and the vaccine rates were low in Northeast Calgary. He at least empowered public health to go meet with cultural leaders, religious leaders, community groups to share information about the vaccine, and it became one of the most vaccinated parts of the whole province in a very quick amount of time. So if the government wanted to act serious on measles immunizations, they would be empowering public health to get out there and meet with folks, and they'd be telling people to get vaccinated. It's been a lot of work to get them to even use the word vaccination. They seem to be using it a little bit more now, but remember that we've we've been the hotspot in North America. More cases in Alberta than the entire United States combined. That is not good for patients. It's not good for family members. And often it's young children who are most negatively impacted by this. So the government should really be empowering public health folks to get into the front lines, connect with people, and help them protect themselves and one another.
And Mark, do you have a follow-up there?
Just really quickly, what do you think of the Alberta's "Don't Get Measles, Get Immunized" campaign? Is it too late for some? Should this have been put in place? A while back? And do you think enough's being done on that front to get the messaging out that they are trying to push right now?
Well, the then Chief Medical Officer of Health, who I think it's been about 6 months since he was out of that position, maybe even longer, said he flagged it a year earlier. So he thought it was important to start on this campaign at least a year and a half ago. I don't know about this specific campaign, but make sure you get your vaccine. Other updates, so maybe they are targeting them in specific parts of the province that are lower. I can't say for certain, but I can say with a great deal of confidence that public health experts said this campaign needed to start a year and a half ago, and that's when it should have started, and they instead played politics, the UCP, around vaccines in general, and we're seeing the consequences of right now in terms of public health.
Okay, seeing no other hands online and just doing a quick glance of the room here, I think we are good. Thank you very much, Sarah. This concludes today's press conference.